Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
For quite a while. Uh, he it is interesting because he is a surgeon, in spite of advice to the contrary by some of the deans of the College of Medicine. They felt that because he's had sickle cell disease and had a splenectomy, that he should not go into medicine, into surgery. He could be a doctor, but he certainly didn't have what it takes to be a surgeon. But in spite of advice to the contrary, Wayne Frederick persisted and decided to go into surgery. Uh, actually, was a resident under my chairmanship and was probably the nosiest resident I ever met because everything I did, he knew about, whether I wanted him to know it or not. And he would remind me of that under the most unexpected circumstances. But be that as it may, Wayne was a student of a very unique student because he wanted to learn everything that was going on and wanted to know everything, wanted to know all the details of everything that I was doing. I really didn't understand what was driving him, but that was a situation. And after he finished his residency, did a fellowship at uh, Memorial Sloan Kettering, right?
At MD Anderson.
MD Anderson, okay. At MD Anderson. And then after he finished his fellowship,
Serve and worship
he went to
their own God.
University.
Therefore, I decree that the people of
We can hear you, so if you would go on mute. So he went to the University of Connecticut, and we thought Howard had lost him. He, after a successful tour at the University of Connecticut, we were able to let him come back and join us and in the Department of Surgery, where he swiftly rose through the ranks to become a professor of surgery. And then, lo and behold, he demonstrated a keen interest in administration, something that I never liked. And actually, my predecessor, LaSalle Lafont, wasn't in love with either. But he had a special gift for administration, and he seemed to love doing it. And the next thing you know, he was uh, a vice president and then president of Howard University's College of Medicine, which he served as the president for 10 years, probably the most advanced 10-year decade in Howard University's history. So much so that when he finished his tenure as president, they actually named the library after him. But there's so much that I know about Wayne Frederick, but I won't bore you with all the details because after he finished his 10-year tour at Howard University, he recently accepted an interim CEO position at Memorial Sloan Kettering, which is one of the most distinguished cancer centers in the world. And so, because of his background and his keen interest in everything that's going on, I thought he was a great person to help us as we go through what seems to be a 4-year period of anxiety and great fear and trepidation. And so I asked him as we celebrate our 50th anniversary of the Howard University Transplant Center Group to talk to us and to help us understand what's going on and to prepare the strategies that we need to help us survive what appears to be an era that is takes us back to the 19th century and the uh, uh, post-Civil War period. So without further ado, one of my great friends and one of my most fervent supporters in my whole life. A good friend, Dr. Wayne Frederick. Welcome and thank you for agreeing to educate us and empower us as we move forward.
Sure. Thanks very much for that generous introduction, Dr. Khan, and thanks for having me. I hope it's to be interactive. As Dr. Callender pointed out, I've had some administrative roles that brought me in touch with the government significantly. So understanding of kind of the landscape of what's taking place now is something that I've probably had an unusual seat to see, and a significant part of my presidency occurred during the first Trump administration, and seeing some of these things. It's similar playbook, probably just more, I would say, a little more refined. Is what we've seen, but I've seen some of these things before and certainly have some perspectives about it. First, let me start by probably laying out kind of what that interaction looks like. So, Howard University is one of two non-military higher education institutions which receive money from the federal government via federal appropriation. So it's actually a line item in the federal government every year. When I started my presidency, it was about 220 million. When I left, it was 250 million. And in addition, in the last 3 years, we got a special dispensation in addition of a total of 300 million to build a new hospital. So very unusual federal appropriation. The other school being Gallaudet. The big difference with Gallaudet is that they actually have active congressmen and women on their board. So their appropriations, I would say, cycle is a lot less difficult, as it would. They actually have people who are sitting on their board who can go to Congress and, actually insert a certain number in the bill. With Howard, I had to interact with all 443 congressmen and women and with all 100 senators to make the case. Any one senator or one congressman or woman could basically say, we don't think that this is an appropriate allocation, and they can move that number all the way down to zero in any given year without any precursor conversation with anyone. And obviously, in this climate, that is something that is real. I currently, I'm the CEO of the American Cancer Society and the American Cancer Action Network, which is an advocacy lobby group. So we get a lot of information on the government. So, for example, I'll share with you in confidence that on Friday I saw a video, and I'm sure any of you watch the news these days, you will see these ads that are being put out by these political action groups supporting Trump's activity, lauding it, basically, etc. The ad that was sent to me on Friday basically has a line in it. It ends by saying that by 2029, Donald Trump is going to make cancer history. In other words, he's going to cure cancer, have cancer cured by 2029. I mean, it couldn't be any more audacious. MD Anderson, where I trained, has a motto that says making cancer history, and they draw a red line through cancer. So it's a little play on words as well, making cancer history in terms of discoveries, but also making cancer history in terms of getting rid of cancer. And they basically use the exact same term at the end of this ad. So very treacherous when you think of what's happening in Congress now. We actually are concerned that we're going to fall behind as you interrupt research dollars, as you interrupt the expansion of Medicaid. You actually are giving less access to a wider variety of people, and therefore putting, really putting the advances that we've made at risk. And so what I thought I would do is probably touch on things that I think are relevant, whether we're talking about cancer or transplant in terms of access to care, and also probably talk about the impact that research and the changing of it could have on it. So I'll start with research first. So one of the things during my presidency I was very focused on was having Howard become an R1 institution again. It had been an R1 institution, lost that designation in 2005. That's a Carnegie classification where they look at the number of postdoctoral fellows you have, they look at the number of PhDs you award, they look at the number of volume of research expenditures you have. And based on that, they designate you as a very high research institution as an R1. And so, after a decade of my presidency, we were awarded R1 status just this past January. That decision was made last year and announced in January. What that allows is for an institution like Howard to apply for grants at a certain level. And there are some grants that they actively invite R1 institutions to apply for. So the rest of the institutions don't even have access to those grants. For instance, Johns Hopkins has a grant with DARPA, which is a division of the Department of Defense, where they do a very high, top secret research activity. Nobody even knows what the activity is, but they get paid on that one grant, 1.4 billion. Just you get to add an indirect cost. And so the indirect cost basically pay to keep the lights on, help you with deferred maintenance in your buildings, et cetera. That indirect cost could be as high as 80% on some of those grants. At Howard, when I started, it was 20-something%. And as we improved our research standing, it went up to high 30s. And now with R1 status, it could actually be over 50%. So when you think of monies that could come into an institution to support education, support deferred maintenance of buildings, it's a significant amount of money. The executive order that was signed basically breaks that down and caps it at 15%. Now, if you do that, you immediately take away a large sum of money for some of these institutions. So if we use the Hopkins, that one grant of 1.2 billion, and let's say they were charging, 80% indirect cost on that 1.2 billion, and you take that all the way down to 15%, you're talking about maybe $400 to $500 million that just goes away. And some of the headlines are sensational, I think, and some people feel, well, it may not be as bad. I actually got a text from a Columbia University faculty member last night who had $2 million worth of grants. She researches in the area of rare diseases, and she received a letter 2 days ago basically canceling those grants. I serve on the board of Save the Children. We are primarily funded by foreign aid, USAID in particular. We laid off, we have 16,000 staff all around the world. We laid off 2,300 people. The executive order was signed on February 26th. On February 27th and 28th, we had to stop work in 50 countries, 460 people. When you think of their families and their extended families, that's about 6,000 people impacted. But then when you think of what they were doing, everything from meals to HIV medication to, you name it. So very devastating. Now, what are the consequences of this? So some people may say, well, why are we giving money to foreign countries anyway? And we have domestic issues that aren't taken care of, and we probably should be diverting that money here. Actually, USAID money also goes to local issues. So you look at places like rural Kentucky, there are places in this country where people still don't have running water, et cetera. And those are gaps that we fill in Save the Children. People don't have access to healthy meals every day. That money also helps with that. So the other consequence of this is that some of those things have also been cut off. And I would say inadvertently, because obviously those are obviously very red states, and the intent there, I would assume, was not to harm the base, as it were, but that also is part of the consequence that's occurring. The international consequence as well is that one of these states, I think in the next 6 to 9 months, can easily fall captive to a terrorist group, or for that matter, since we're competing so fiercely with China, who has been nation building around the world for decades now as part of their long-term strategy, they're not going to have competition. They're not going to have someone else to be concerned about being in those countries, supporting them. So from a national security point of view, it's also not in our best interest to kind of walk away from these areas as well. So that's the impact of research. I'll switch gears and probably discuss Medicaid and Medicare. I sit on the board of Humana. We administer Medicare and Medicaid programs throughout the country. Medicaid expansion is something that a lot of people have been pushing for in several states. Again, largely Republican-controlled states do not support Medicaid expansion, and therefore their citizens' access to Medicaid and care is limited. So it's unpopular now to talk about DEI, but it's very interesting if you look at who gets hurt and what actually qualifies as DEI, especially if you focus on health equity. The worst outcomes for cancer care in this country are now in, I would say, probably three main states, Alabama, Mississippi, and Alaska. And they all have the same issue, and that's access to care. In Alaska in particular, it's actually a geographic issue. In some cases, those citizens have to, catch a plane, travel over 100 miles to get something as simple as a mammogram. And any of us who've had either a mammogram or prostate cancer screening, you may get a mammogram, go back home, and then get a call from the radiologist that there's something else that doesn't look right. We want to repeat. So that's another flight. Then you have to go back for a biopsy. Then when the biopsy comes back, you get a result. You have to go back for surgery. I mean, by the time you add up the back and forth that some of those patients may have, it's pretty significant. And you have the same issue in Mississippi and Alabama, where you just don't have the right types of specialists available. But that's an issue occurring around the country, especially in rural areas. And again, a lot of these are dominated by Republican governors, Republican senators, et cetera. So the concern there around health equity is a real one. And I think one that ultimately is going to impact a much broader band of people than I think was initially thought of. The other issue is that 13% of all cancers that we know of today are probably caused by viruses for which we have vaccines. So we have hepatitis vaccine that prevents hepatitis infection and ultimately cirrhosis and liver cancer. We have the HPV vaccine, which prevents the spread of the human papillomavirus and is associated with cervical cancer. And what has happened in the southern states around measles is a major concern that we have. There's no law, nobody has declared that you should stop taking vaccines, but the general sentiment in the country that has questioned the safety of vaccines has resulted in a decreased number of people taking the vaccines, and that is a major problem. We were, I would say, on the cusp of probably getting cervical cancer almost eliminated. Another 10 years, if we kept up that HPV vaccine program, you would rarely hear about cervical cancer. And now we have an explosion because there's a lot of confusion as to whether insurance should cover it. There's a lot of confusion as to whether it's safe. There's propaganda on the internet, some of it unfortunately supported by the new Secretary of Health and Human Services, that the virus is live and that you can actually get the disease from the virus, which is completely untrue. But that lack of uptake of the viruses is one that's concerning, very, very concerning. And so we have to watch that. And then I would say that the last thing of concern is just kind of how we're going about the government efficiency exercise. We have a very aggressive program and mandate taking place in the federal government. The United States African Foundation, as well as the U.S. International Peace Organization, were both visited by DOGE personnel this past week. In both cases, they were refused entry into the buildings. The staff locked themselves in, basically. They then came back with FBI agents and DC police to gain access to the buildings. Very aggressive tactics. And you have to remember, those organizations are not state agencies. Those are organizations that are supported by the United States government, but were stood up to be independent and to function independent of the government. So these tactics are aggressive in terms of Doge individuals accessing offices, demanding to see data, and also quickly determining that whatever activities taking place needed to stop immediately. And so that's a really it's very concerning when you think of living in a democratic society in which you have elections, which have consequences, by the way, and also that you have a process, and that when Congress designates spending, there's an expectation of how that will happen and where it will go to, etc. Probably the most dramatic thing that will occur, I think, in all of this will occur today. The president is prepared to sign an executive order at 4 o'clock this afternoon, which will begin the dissolution of the Department of Education. And I am not sure that the country has really been thoughtful about what impact that has. So to paint a picture for you, 80 to 90% of the budget of the Department of Education is really about higher ed, which is why I always think this conversation is a very skewed conversation. The impact the federal government actually has on the support of public K through 12 education is not what we think. It's really a state-designed issue. So their argument that they're trying to push this back into the state is really a false argument. This is a higher ed issue. It involves loans, it involls Pell Grants, and other types of support, especially for low-income students. So the people that will be harmed the most, in my opinion, with this dissolution and potential removal of funding from the Department of Education, I think will be Black and brown students who are aspiring to higher education. I think already you have the Supreme Court decision. This will come on the back of it. It's going to make access to those loans and stuff more difficult. It probably will be privatized, which means that the access for students will go away. The Pell Grant program, actually, which is an untold story. I actually took this to Congress one year, trying to convince Congress and the Senate to get behind this potential opportunity. As much as $18 billion every year of Pell Grant goes unspent. And I made a proposal to Congress and the Senate to take that money and reinvest it into states and schools that had less. So HBCUs, for instance, you could easily every year put another $3 billion into HBCUs just on Pell Grant money that's already designated for spend that doesn't get spent. So it's not a matter of going and finding new money. It's money that's already allocated that just doesn't get spent because enough students who qualify for Pell Grants don't apply for them or don't even apply to go to college. And so there is a pot of money there. I think those types of dollars the government is going to take back for the other activities that they want to participate in. And I think that could be devastating. I think HBCUs will have to shutter their doors because of their heavy dependence on federal government money that I think could potentially go away. Interestingly enough, I think the president is also going to designate that the White House initiative on HBCUs continues. But as he did in his first term, I think he's going to put it back in the White House. Again, interesting that President Obama had moved it to the Department of Education, which I thought was unwise. And in his first term, he moved it to Trump's first term, he moved it to the White House. Biden was a little bit ambivalent about it, I think. And then now we're hearing word that with the executive order, he may announce what he's doing with the White House initiative on HBCUs, which people may on the surface think is a good thing. But again, there's a lot of treachery involved. The HBCU designation, most people don't realize, is actually a federal congressional mandate. A bill was passed in 1963 that designated the term historically Black colleges and universities and it was based on a historical support of educating former slaves. So, in other words, if I started an HBCU today, or started a university today, I could not go call it an HBCU. Actually, it's a federal designation that allows for a certain type of funding under one of the statutes. That could get challenged as well, with the whole DEI issue. And if that gets overturned, that special funding for HBCUs will go away, which means that those schools will immediately collapse. Some of them are on the brink right now, and that would probably be a very fatal blow that can occur. And just in case, again, people think, well, the argument has been you can go to school anywhere now, you don't need these schools. 26% of the bachelor's degrees given to African Americans in this country are given by HBCUs. Howard graduated 7 students in physics in my 8th year of my presidency. That represented the highest number of African Americans who graduated with a physics degree anywhere in the country. 7. Just 7 kids we gave bachelor's degrees to, and that was the highest number in the entire country. So we really, are in, I would say, a very, very treacherous position currently. And with this executive order that will come down today, I'm not sure that we're quite understanding the gravity of what would take place. And then I'll close by saying a lot of these things, and I'm happy to answer any questions. The 3 concerns that I have. One is that the dismantling, while it seems chaotic, is well orchestrated from the perspective of even if the pendulum swings back, right? Let's say you get a very left progressive president in 28. Let's say Gavin Newsom wins the presidency and decides that he's going to put all these things back in place. It will be almost near impossible. The workforce, institutional knowledge wouldn't be there. The systems and structures wouldn't be there. And the way the federal government money will be tied up for years to come, it will be very difficult to unravel. Second, the Supreme Court, that branch of the government, is well entrenched for at least the next 40 years to be very, very conservative. I remember when Dr. LaFolle taught me, William Rehnquist had an operation and wore a cravat post-operation. And Dr. LaFolle kind of used it as a teaching moment and had us, his question to us was, what do you think William Rehnquist had? And the answer to that question was he had an anaplastic thyroid cancer, which is almost a death sentence. If you go back and you look at what George W. Bush did, he then subsequently nominated his White House attorney to be a Supreme Court justice. That was deadpanned. Again, in a very chauvinistic society, she wore a velvet suit, a purple velvet suit to the hearing, and people focus more on that than the fact that she probably was very capable. And then he subsequently nominated Chief Justice Roberts, who at the time was 49 going on 50. The only medical issue he has is he has a seizure disorder that's under control. Given the health and security of these guys, he will be there potentially till he's 90. So you change the court with these appointments for 40 years easily when you change it. So this is not something that gets overturned, certainly probably not in my lifetime. And that's the other thing that I think is going to make these things hard to undo. And then the third thing that will make it difficult to undo is that part of the dismantling also has been they will then create things that it will be very difficult to bring some of those things back in their current form. If you move the federal student loan program and privatize it completely, it's going to be very difficult to wrestle that back from them. The same thing with mortgages and Fannie Mae, et cetera, which is another part of what they're proceeding to do. So home ownership for Black Americans is going to go down. So this is a very systemic issue. A lot of these things, people are asking, well, if they close the Department of Education, where some of those functions are going to go, they're going to move it to OMB, which is already probably the most powerful office in the government. The problem with OMB is, who did he just put in OMB? Russell Voigt, the architect of the Project 2025. So while they denounced Project 2025 during the campaign, the most control of the probably the most important control of the purse, which is at OMB, is now in the hands of the architect of the Project 2025. So the more things you move to OMB, the more you ensure that the dollars are going to fund what you want it to fund, and certainly not going to fund the other programs that you don't want it to fund. So I think I personally think we're in a constitutional crisis of some sort. And unfortunately, we have a big void left by the Democrats in terms of, I would say inaction or inability to really pivot and make it. I don't want to leave you with just a dark image, because I always feel like, that there is an opportunity. That opportunity, I think, is we have to do way more convening. I think there's a lack of knowledge in our community and in the country in general about what's going on, the pace at which it's happening, the consequences, and actually what the law is. I think that there's an issue there. The second thing is, I think we also have to convene around seeing the things in our communities we want to see. I remember when I recruited Ta-Nehisi Coates and Nicole Hannah-Jones to Howard, I had a faculty member come and ask me about the banning of books and wanted me to put out a statement about the banning of their books. And I said to the faculty member, I said, okay, I'm happy to do that, but let me ask you something. When was the last time you went to a public library and picked up one of those books and read to students in a city, read one of those books in a city? There's no law that bans you from doing that, but I'm just curious as to the last time you did that. And that person kind of looked at me, sheepishly, because they didn't even know where the public library was in their neighborhood, right? So there are things that we can do while we complain about the system needing to have strength. I think we also have to, take it upon ourselves to be part of the solution and to make sure that either people are being educated, or we're engaging with our legislators, or our state senates, et cetera. I mean, that's where it starts. I think the long game that Mitch McConnell played on the Supreme Court is a classic example of how these things get done, and why we have to work feverishly and play the long game in order to make sure that we see the things we want to see. So I'll stop here and happy to, answer any questions anyone may have.
All I can say, this is John Tatum. Good morning, Dr. Frederick. That's a heck of a presentation, very informative. And I'm thinking it is also dismal, very dismal. And so I don't know if this is going to take us back to slavery or not, but what can we do is the question. What should we do?
Well, I think we have to pay attention to the things that we're concerned about. I think one of the things that you want to start doing now is paying very careful attention to Medicaid expansion. The impact that could have on transplantation for minorities in particular, and their access, could be devastating. So I would say, making sure that you know how to access your representatives, both in Congress and at the state level, and starting to raise the issue, calling them, writing them, showing up for when they visit, to make sure that they're aware of the issue and they're aware of the consequences, I think is important to do with respect to Medicaid. I would say the other thing that must happen, the pipeline for things like transplant surgeons is compromised, in my opinion, already. When you look at STEM education in this country, and you think of what could happen to you look at what could happen to K through 12 education, it could be devastating. It's already not well funded in some states, and certainly in underrepresented areas. And so I think making sure that those public schools, get as much funding as possible, I think is also another critical thing that we can do. And I would say, it's dismal, but I wouldn't lose hope. The democracy in America, I think, is messy. Howard was signed into existence on March 2nd, 1867, by the 17th President of the United States, a guy named Andrew Johnson. He was a misogynist. He was a known open racist. As a matter of fact, Andrew Johnson, I think history would say, was probably a compromise by Lincoln to the South when he made him the vice president. Obviously, he never thought that he would be assassinated and this guy would become president, nor did his own party think that would happen, right? However, he did become president. His own party led his impeachment. He's the first president to be impeached. He created Howard University by signature. And the same day, he vetoed the first Reconstruction Acts. So the pendulum swings. I think even when people have bad intent, especially for Black people, they sometimes inadvertently do things that they probably don't realize the impact. And so he created a university that the first female Black vice president would attend. Right? I'm sure that that was not what he wanted in his legacy. So I don't think we should lose hope, but we need to make sure the democratic process stays strong.
Darryl, Armistead.
Thank you, Dr. Frederick, for a very enlightening presentation. And I just wanted to focus a little bit. You said we need to focus on how we can be part of the solution. And if I understand you correctly, a lot of what you're advocating is that we follow the political process because elections have consequences. And a lot of how the public reacts is according to their awareness of the problems. I understand that we're not getting it's not an equal broadcast. What we're getting through the media is the political action committees are applauding what Trump is doing without talking about the consequences of some things, like even dismantling the Department of Education. What my concern is, even though we've got political processes to be part of the solution, there's some things that we may not be able to overcome for another 40 or 50 years, just because, like, say, if they dismantle the Department of Education, it may take a long time to put that back together again. So for things that are being dismantled in the federal government, are you thinking of other options that we could be part of the solution other than the standard political process?
Yeah, I think you bring up a very good question. This is my observation. If you look at the news cycle, the one thing that he and his team learned from he and his team had learned from the first term is that they have to use the media well. So what was the first thing they did? They picked the media, right? I mean, who does that in the political process? So they decided some journalists needed to leave the room, and they would have certain journalists in the room. When Zelensky came, they made a big fuss about how Zelensky was dressed. But you have Elon Musk in a cap, a T-shirt, every day that Trump is speaking from the Resolute desk with him standing next to him and nobody asking Elon Musk about his dress, right? So they've effectively, I would say, controlled the news cycle. And then every day there's a pattern. In the morning, they flood the news shows with the Republican congressional folks to speak. They have a midday press secretary conference, which is really a recycle and rehash of the nightly news. So whatever came up in the news that they don't like the narrative on, she addresses it at noon. They sign executive orders at 3 to 4 to control the night schedule news so that every night you turn on the news, there's a new executive order or something that the president has done. And he's answering questions every day. So he's on the media every single day, every appearance, etc. So to your point, in terms of information and misinformation, they have effectively controlled what is coming to us. So I would say the first thing we need to do is to combat that you have to create an engine that gets the news out. Now, unfortunately, the Democratic Party, I think, has been caught off guard, doesn't have a plan around it. So it's not like they're running counter ads or, they have some event. And so, like I was telling some of my colleagues at Howard, we need to hold a weekly vigil. One of the reasons I recruited those public intellects was to have them create a dialogue in the country about where we should be. I mean, currently at Howard, you have Michael Steele, Stacey Abrams, Nicole Hannah-Jones, Ta-Nehisi Coates, Sherilyn Ifill. I mean, the power that you have to be able to convene and to create a dialogue is there. And I'm hoping that that's something that they would do. I think in terms of outside of the political process, I think you bring up a very good issue. I think we have to do both. I think you have to work within the political process, realizing that that may change slowly, which is why this has been so chaotic and quick, because they recognize that if they wait for the political progress, if he waits for Congress to close the Department of Ed, that's going to take too long. So he's going to sign an executive order to do it to force the issue, right? And so I think we still need to build the political process, but we need to build it from a grassroots. The 2026 elections, I think, are a critical election cycle. And which is not being covered by the news. So far, in the first 3 months of his presidency, so far, well, I would say 2.5 months or so, a lot of the special elections have actually gone to Democrats, even in states where he won or districts where he won by more than 21%. So the political wheels are already turning against them, and they recognize that, and which is why they're trying to move so quickly. I think we also have to consider creating community action groups that protect our communities. I think our reliance on the government to do those things, I think, has been a mistake throughout our history. We will look out after ourselves better, and we need to look at those programs that exist already and see how we can strengthen them in order to provide a safety net. So one of the areas that I'm very concerned about, but I think is an opportunity, is healthcare. I'm not sure how much we recognize the community groups in some of the underserved neighborhoods really participate in trying to get people good nutrition, access to healthcare. Those programs we really have to beef up. Screening, Howard does a prostate cancer screening every Thursday. They do a monthly free mammogram. And that's just one of many programs that exist all throughout this country that now I think we have to take our dollars and support and make sure that we're taking our dollars there to make sure that those programs are stronger. It's an uphill battle, but we have to get moving now. We can't wait for the established political process. I do agree with you on that.
Deacon Jackson, you were next.
Thank you, Dr. Callender. Let me first preface what I'm going to say to Dr. Frederick. I appreciate you situating the time. This morning, it was just recently communicated to me by my brother that he has a kidney challenge. He does contend with diabetes and high blood pressure, and I'm sure that probably gave him a predisposition to kidney failure. Is there anything that would be suggestive to more or less make for a better situation so that it just doesn't constantly get worse? His doctor informed him one is functioning well, but the other one isn't. Is there anything that you could suggest that might prevent further deterioration or functionality?
Yeah. I would be loath to do that in front of probably the one individual who's had the greatest impact on minority transplantation in the world. I tell people all the time that Dr. Callender, when all is said and done, probably would have impacted minority transplantation more than any other single person. I'm sure he can give you answers. What I can tell you is, things like preventing further deterioration by making sure that you control your blood sugar levels really tightly, I think is critical. One critical aspect, but I'm sure he has a wealth of advice that he could pass on to you. So I'm going to defer to the expert here.
Thank you, Wayne. I think it is critical that he has a nephrologist that addresses both of those issues. Nowadays, they do have medications that once you make the diagnosis, can slow down the progression of kidney kidney failure. And so his nephrologist is the person who can make that happen. Dr. Perez, you're next.
Likewise, thank you for this outstanding presentation, something that is so critical right now. And one of the things that you talked about in terms of what we can do now, one, in terms of communication, getting what you shared this morning out on a regular basis to our congregations, which when we think about HBCUs, I don't think there is one that wasn't heavily supported by a church or a denomination. And how we build entities or utilize entities to build the structures that we can no longer rely on as it relates to federal money. And how do we begin to secure our coffers so that we are able to respond to our community? It's the philosophy that you shared that was behind the Black Panther Party. We have to protect our own. And if you could speak on that, I would appreciate it.
Sure. You bring up a very interesting point. When I took over at Howard, we were raising about $12 million a year, to my shock. I mean, you think of the tens of thousands of Howard alum, and our alumni giving rate was 4.96%. I was totally shocked at those numbers. What it said to me is that we did not have people who were supporting the university financially, despite the fact that they benefited from having a degree from the university. And so that, I think, has continued to plague us. Now, I would often compare the Black church and our community's support for the Black church. And I would try to make the argument that if we want a strong Black church and a strong Black community, we have to support our Black institutions of education. Because if they don't exist, the decimation in terms of that middle class that was so well built will go away very quickly. My last year, we were able to raise 241 million. Alum accounted for very little of that. So one of the things that we have to do, I think, in this time, when you think of building it up and where it must come from, we have to make the case ourselves to support our own, but we also have to make sure that we tap in to this huge Uber wealth that exists. Steve Schwartzman at Blackstone was paid in the last 2 years consecutively. He was paid 1.1, 1.2, and $1.3 billion each of the last 3 years. Just one person. Blackstone. We have to engage those people. We have to say to them that these are causes that are sure. Now, it is tough to do that when we don't support our own. And I'll give you a classic example. I went to an event at Vernon Jordan's house a few years back while I was president. And I got close to a fireplace and I saw Jeff Bezos, Warren Buffett, and Bill Gates standing, kind of talking to each other. And I thought to myself, if these guys gave me their pocket change, Howard would be fine for the rest of the distance, right? Just their pocket change. They didn't have to write me a big check. And I walked over to them and started a conversation with all three. And then Warren Buffett in particular kind of just zoned into me and started asking me questions about Howard, the size of its endowment, what the revenue base was. I mean, just all these financial questions. And I was giving him answers. And then he said to me, "What is your alumni giving rate?"
Uh-oh.
Right. I remember at that time it was 4.96%. I didn't even want to answer. So I looked, I kind of turned to the side, and sure enough, President Obama had just entered the room, was coming through the door. And I said, "Oh, here's President Obama," to try to deflect. And he said, "Yeah, he's going to come over and talk to us to answer my question." And so just think of, after the answering that question, to then make the case to somebody like a Warren Buffett to write a check to Howard, when the very people who benefited don't do it. And don't get me wrong, this is not about financial wealth. That alumni giving rate is determined by each alum giving $1
Yes.
every year, right? And I've said to alum before, even if you're angry, give me an angry dollar. I'll take it, because if I can show up in somebody's office and say, 70 something percent of my alum give, that's a very different conversation to 4.96%. We were able to get it to 13 to 15%, but it pales in comparisons to the schools that do very well. So I agree, we have to give to ourselves. And I think part of building that up is making sure that we are, speaking to people about why, about what those dollars go for, and being responsible about it. I think the second thing is we have to do way more in the community as far as being active. Um, I had some nutrition students go into Southeast a couple of years back. I spoke to the Dean of Nursing and Allied Health, and I said to her, this issue about nutrition and food deserts, it affects people in Ward 7 and 8. If you're a Black man in Ward 7 and 8, your life expectancy is 22 years less than a white woman in Ward 3. Look at how small DC is. That's an incredible statistic. Just by being born and living in Ward 7 and 8 in the nation's capital, as a Black man, you're expected to live 22 years less. You cannot build generational wealth if you live 22 years less than someone, just by the math of compound interest. So we cannot continue to separate our health argument from wealth. And I think another thing we need to do is to really try to focus on the health of our community, educating people about good nutrition, making sure that they're accessing primary care physicians. I think it's in our best interest to make sure that our group is healthy. And then the last thing I would say is we have to focus on the future, which are the young ones. Howard has a middle school on its campus, and over my decade as president, I got to interact and see those young people. And it's amazing what they go on to do. 96% of them go to attend college. 60% of them choose a STEM field. And a lot of it is just simply because they're around it every day. If you stop them and ask them where they go to school, they tell you, "I go to Howard University." They don't tell you, "I go to Howard University Middle School," right? So they've already got it in their head that they're heading to college. And so we've got to invest earlier. I think a middle school should be on every HBCU campus in this country, because the impact it has in terms of the exposure is absolutely incredible. But we all have to do our little part, and part of it is having the conversation. I know people are sick of the news. It's tough to watch the news sometimes. It's depressing, but we have to be engaged. We have to be educated about what's happening, and then we have to encourage our family members and community members to have a conversation about it. Yes, it's not great news, but I can assure you that bad news doesn't age well. And so whether you hear it today or 60 days from now, it's not going to be any better. If you wait to get it, you might as well get it when you could potentially, do something about it.
Sounds like a good Sunday school lesson or a sermon. And that's how we build it. When we talked about numbers, prior to the internet, it was the drum. I had the opportunity to be on a university board, and like clockwork, they pump the alumni. And it's totally different strategy than I'm sure is used at HBCUs, where we know people are already tapped, but it was like tithes and offering. People who donate. I bet if you looked at the numbers as it related to the fires in LA or any disaster, we overwhelmingly support. We just need to redirect our attention. Thank you again for what you've shared. And I challenge, your availability to share some of this with definitely the pastors and leadership in the Second Episcopal District of the AME Church.
Sure, most certainly.
Dr. Perez, Dr. Callender, you're muted.
John Buchanan.
John Buchanan is next. John
Yeah,
Buchanan
he's
is
next. John Buchanan.
Well, thank you, Dr. Frederick. I'm in awe of your perspective. I had a question you mentioned about that Project 2025 person being put in charge of OMB. What's the more direct result of that? Because I think, if I'm not mistaken, Trump denied any association or affiliation with that when he was running for president this time. And now it seems that was a lie among many other lies. Can you address that?
Yeah, sure. Russell Voigt is the director of OMB. He's a 48-year-old Republican. And as I said, the control that potential position has is really very, very significant. So, I am very concerned as to where this will go. He's a Christian nationalist. He founded an organization called the Center for Renewing America that opposes critical race theory and advocates for the idea of America as a nation under God. And he played a very significant role, as I said, in Project 2025. So basically that playbook is what he intends to use in this. And so I would say we're going to be in for a rough ride because remember OMB, for instance, Howard's appropriation, just to show you how it works. Congress could pass a bill that says, Howard should get X amount of dollars. The way that even begins is the Department of Education, the Secretary of Education sends a recommendation as to how much we should get to OMB. So the White House submits a budget, Congress submits what they want to do in the deal making, and then they come up with an amount. But the people who really control the purse string ultimately is OMB. So right now we have a continuing resolution, which means that although Howard should be getting some 60-something million dollars every quarter, because it's a continuing resolution, OMB decides how much they should get of that 60-something million. And because it's a continuing resolution, they save money so they don't run out of money. And that calculation is fairly arbitrary. They may decide to send Howard 50 million. And yes, they often do catch up, but that's in another cycle, right? I don't get to tell employees when I was president that I'll give you 3/4 of your check now, and when OMB sends us the rest of the money next year, I'll give you the rest of your check, right? I don't get to do that. And so it can really adversely impact spending. And if you familiarize yourself with Project 2025, you'll see some of the things in there are extremely archaic. There's another executive order the president is thinking of signing that basically will overturn the fact that the law that was passed around the Civil Rights Act that included a provision around the ability to desegregate, the willingness to desegregate, so that you can't say that certain people can't come to a particular venue, etc., there's one little area in there that they're thinking of signing an executive order that will do away with that, so that they can, and their claim is that if people want to convene without certain other people, they should be allowed to do that. Well, that's resegregating the country. Under any type of explanation, you're trying to resegregate the country. And so I think this guy, at the end of the day, if you follow the money, that's what really ends up happening. And so I think this, of all of the people in that government right now, and this is a 49-year-old guy who this is his second time in that office. I think it could be devastating in terms of what programs get funded. You think of things like SNAP that provide nutrition for kids, all of those types of programs could go away under this guy. So I really see OMB. I think watching the activity of OMB is going to give us a good indication of what's going to happen next.
Thank you so much.
Dr. Frederick, this is an interesting group of about 15 to 20 people that meet every Thursday. What can we do to take action and help overcome some of these horrendous items that you discussed that are going to happen to all of us?
Yeah. Well, I certainly hope that this will stimulate you to have conversations, to look at the news through probably a different lens, to make sure that, your family members and friends as well are getting involved in any little way that they can to educate themselves. I think the second thing is, especially for what you support around transplantation, I think the Medicaid issue is a big concern for me. And so making sure that you keep abreast of when those laws are coming through. But again, you want to be proactive. So this is the time to be calling your congressman and congresswoman and saying that you have a concern, or writing to them and making sure that they don't allow anyone to do away with Medicaid or to keep contracting its support. I think is going to be very critical as well. And I think we have to do more of these types of events. So I'm thankful you already did something by inviting me to talk, hear your concerns, answer your questions. I think we have to do more of this in our community as well. I think you'd be surprised at how effective it is, because if each of us takes it upon ourselves to go and have another conversation with another 15 people, we begin to have a much larger impact.
Dr. Frederick, I know your time is of essence in your many positions. We have two more questions. Do you have time for them?
Yes, sure. I'll be happy to answer.
John Tatum and then Dr. Perez again.
Yeah, one thing we can do is you people can stop voting for Trump.
Yeah, it's interesting. If you look at the numbers in the election, there's a combination of two things. One is how many people did vote for Trump, but also, in all fairness, I think for us to have a balanced conversation, we've had a Democratic Party that I think for decades have taken the black vote for granted. And I've often said the black vote is not a monolithic vote. The Black Church is probably one of the more conservative organizations in this country.
Yes.
And the Democratic Party allowed Trump in particular to take advantage of a circumstance. Everything from, you look at laws under Clinton in terms of imprisoning Black men and what that did for families, those things catch up with you over time. And I've often said that I think taking a certain part of the population for granted was always going to be a mistake. I mean, to move from getting single digit Black vote to double digits and even up to 20% in some areas is very significant, and to your point, would tip it. But we've got to, I think, be a people who vote for something and not against something. And I think that's where we've got to get, our leaders who represent us to be pushing and advocating for the things that we need. And unfortunately, I would say the Democratic Party, I think, left an opening that we all are paying a price for now.
Dr. Perez?
Dr. Frederick, what is your vision, or do you see an opportunity for HBCUs to go beyond the United States in terms of revenue and support. And likewise, what entities can we be involved in? Because the Black community isn't broke, but how do we then channel resources from Black individuals into where we see lapses and deficiencies that we are being hit with as it relates to the federal government?
Yeah, I think there's been a lot of interest in whether or not we can take HBCUs, outside of the country. I got calls often about having an HBCU in Africa, in the Caribbean, et cetera. It's very difficult outside of America to create that same experience. University of Western Cape in Cape Town is one of those entities that has really educated Black South Africans. Howard University Law School does a combined course with them, et cetera. The infrastructure is very different. And I think it would be very difficult. Our partnerships, I think, are effective. To actually plant a physical presence, I think it's going to take a lot more to do it. Because remember, one of the things that makes our HBCUs work is that you have a Clive Callender at the College of Medicine, but it's one of them, right? How do you get a Clive Callender in Ghana, in South Africa, in Kenya, right? It's hard to replicate that. So what we have to do is to start with the base and to really spread that in terms of making sure that we have the intellectual depth to be able to spread it. And I think that's difficult. So the partnerships, I think, are probably a much better way in terms of appealing to Black individuals, because as you said, we're not broke in terms of where they give. It still is different. We're far more likely to give to the Black church than we are to give to Black higher ed institutions. It still is something that I look at carefully, and I wonder, and I think probably we don't make the argument that our Black higher ed institutions, if they're not strong, the Black community ultimately is going to suffer. And I'm not sure that we take those things seriously. A good example today is you have gene therapy for sickle cell, which I have, but how do you get that to Congo, which has the highest incidence of the sickle cell gene? And there's almost nobody looking at that, right? You have a therapy that costs $1 to $2 million in the US, and there are 100,000 Americans like myself who have sickle cell. And so it's great that you have such a potential, cure, but imagine if you can get that cure to the Congo, right? That's a very different impact. And I think, unfortunately, I'm not sure that we make that argument, or we collectively really sit down and plan for what our priorities are, as a community, and go after that in particular. And then you have a big divide between the senior population and the younger population, right? I have a 20-year-old and an 18-year-old, and I think what pricks their conscience, their consciousness is very different. And I think that we have to also recognize that as well. They see the world through a very different lens. And that's something that I think we often ignore in terms of kind of what really motivates them, and why they would be motivated to go give their monies to a particular cause. And we have to start making that argument to them now, rather than being dismissive of them and of their thoughts.
Betty Blaylock and then Terry Smith.
Yes. Thank you so much, Dr. Frederick, for that presentation. And one of the things that had stood out to me, a couple of things, but one of the things was the fact that you said that if the alumni of the schools would give $1. So I remember back when my father, well, we weren't rich, of course, but my father always gave to Benedict. we sometimes didn't have the right food on the table. But my mother would say, and you still giving money to Benedict. But he always gave money to his alma mater.
Yeah.
So even though I never went to college, only a couple of my siblings did, but I know people who went to college. So I know I can't do a lot, but I am going to talk to all of my friends who have gone to colleges, and some of them to HBCUs, and tell them the impact that they would have if they would give to their colleges. And if all of us, that's a start, if all of us on today would share with our friends and share with our colleagues and people who have been to colleges to give to their colleges. And even though I didn't attend a college, I'm going to choose a college to give to. And I think that's a beginning. And
I appreciate
that's
that.
one thing that touched me out of all the presentation.
Terry Span is next. You're on mute. Can't hear you. We can't hear you.
Thank you very much. Good morning, everyone. I feel improved by being here and listening to the discussion. And what I would like to pose is maybe just a different perspective. I keep asking myself, what is the population of Black people in this country? What is the number? I have yet to be able to really get a clear number. And then secondly, what is the number of actual students that will be in the next 10 years entering colleges and universities? And what I'm trying to do in my thinking is put together in terms of just even a forward look. Okay, because the way I understand it, Trump really was put in place to oversee the dismantling of the country. Okay. And so when I'm looking and I'm seeing all of these various stores that are closing, I mean, all over the place, I'm saying to myself, okay, this is going, Joann's is going out of business and the Big Lots are going out of business. And I don't even have the list, but I'm thinking I'll just ask maybe Copilot to give me a list of all of those things that are closing. So saying that, I'm wondering if maybe we need to look at the HBCUs. This is big, broad thought, and see if maybe they can combine. I mean, if big white businesses are going out of business, then what should our plan be as strategically thinking, forward looking? You won't be able to have an HBCU if you only have a lower population of people coming onto the planet. And our numbers have been decreasing in terms of the number of new babies coming here. So I think we do have to kind of, really look at it realistically, like what are the projections for the next 10 years? And, how many going to college, how many universities can sustain if there's a marked decrease in attendees, and can we be thinking of combining universities? Same way other corporations are now coming together in other ways as others are leaving. So that's my thought.
Yeah, it's actually a very prescient thought. If you look at the birth rate and the pipeline, that's a projection all universities use, and the Department of Education actually, as to how many people are even eligible to go to college. That number has been falling because the birth rate has been falling. So we expect a crisis within the next 5 years of a sharp drop off of even who can go to college. That combined with our immigration policies mean that less students are going to come in to the country from elsewhere. I would say some of our major STEM labs in this country, 60% of the grad students are actually were Chinese prior to Trump's first time in office. That number fell off sharply, and has not come back. Indian students replace them, but even that number is falling off. So we are going to have a crisis, and that is a projection. And those schools have actually started to close and to downsize. I'm not sure about necessarily combining the schools. Obviously, geography is one. As we look at online education, that's something else to consider. Some of the bigger ones are getting bigger as a result. So you've got the Arizona states, et cetera, that all have 80,000 plus students, very, very large institutions with a lot of online. And I think that's a model we have to look at. Some of the HBCUs are getting together to do some things together. We now have an association of HBCU research institutions that support, collaborate with one another. One of the difficulties is that a decent number of the HBCUs are state-run institutions. So there's only so much combining they can do or collaborating outside of the state. Some like Howard, that's private and has a federal, gets federally funded, can't be associated with somebody mentioned, like a church-based institution. When I get the federal appropriation from Howard, I cannot use it. Back then I could not use it and still can't today use it for the divinity school as an example, because the congressional law is that you can't, spend it there. But I do think partnerships with organizations, corporations, et cetera, especially for pipeline for workers and doing more things to get them into the workforce could be a differentiator. And I think that that's a good call out. I think a lot of us are trying to do that. We started a Howard West program with Google when I was at Howard, and we have several with private equity firms, et cetera. And I think that's something that we have to, certainly continue to do more of. Also, differentiating the revenue streams, I think, is also going to be another important thing for us to look at, not just relying on tuition, but really recognizing the opportunity to see those as businesses, and to do the right things by that. So I probably overstayed my time. I appreciate you guys having me. I think, every day when we rise, we have an opportunity to amplify each other's humanity. And that means that we really have an opportunity to go out into the world and see someone else whose situation we may never experience, never live in, never even understand. But we can be conscientious about trying to make a difference to them. And so that amplification of other people's humanity, I think, is kind of my guidepost. And I think that's what all of this comes down to. Governments exist to amplify the weakest among us. The church exists. I think scripture tells us that a big part of what we are to do in life is to make sure that the weakest among us becomes the strongest and that we look out for them. So I think this is about making sure that the have-nots in particular don't get further marginalized and totally disregarded. And so I have faith that we'll get there, but my faith is placed in us. I'm not waiting for the government or a politician to do that. I'm absolutely convinced that we have the power amongst ourselves to uplift those who are most marginalized among us. And we just have to make sure that we stay focused and motivated to do that. So thank you for giving me your time, amplifying my humanity today by listening to me and asking me some great questions and giving me some great ideas. So while the topic probably was a little dismal, I'm going to leave pretty enriched, and think I can think of a better way to have spent my last hour and 20 minutes. So thank you.
Thank you so much, Dr. Frederick.
Thank you.
Take care.
All right.
See you all next Thursday.
Betty, Sister Betty Berrylock, I have been, I'm presently not on the board of Benedict, but I was for over 15 years. Let me tell you, your father, his money, his determination has made a difference. My niece went to Benedict, and two of her girlfriends that she complained every year, but she has her BA. Her BS. She is, I'm telling you, your father's money, your family's sacrifice has made a difference in my life. My niece has a degree because of your father. So I thank you. I thank you. I thank you. I've got tingles when you said that. When you and the board meetings I went to, the fights we had on those board meetings, your father's money went to good work. The community is better because Benedict. So thank you, Betty.
Thank you. Thank you for acknowledging that. But one thing I have to say, my dad, like I said, he gave to Benedict no matter what. But it he loved the school, and he graduated in 51. I was at his graduation. He pursued his education. I'm the baby of 5. I was 6 when my dad graduated from Benedict. But he had some kind of impact there because he was a minister. And when he got installed at one of his churches, I found a letter that my mother had saved that Dr. B. Coates preached his installation sermon. So he was closely connected to Benedict until the day he died. Closely connected.
Girl's father. Dr. Callender, I wanted to introduce you to Terry Spann on the line. She is a program chairman of the DC Public Schools retiree chapter, and she is responsible for getting speakers for our April the 9th meeting. And so we have invited you to come and speak to the retirees on April the 9th at 10:30. And the topic is out there. Terry, do you want to say anything about the topic?
Well, I haven't really pinned it down, but I thought that an excellent topic would simply be back to the beginning, food combining and digestion.
Okay. There we go.
That's a little detailed, but I think that it would it would cover.
Well, why don't you send me a list of topics you might want me to discuss, because that would not be an area that I would feel comfortable discussing.
Okay, and it could be of your choice. I'm open.
Okay.
We definitely will have an attendance of maybe possibly 60, 70 people.
Right.
So anything that you would bring to us would be
okay.
We'll get you
All right. Well, give me a
we'll
list
get
of topics that you would like me to discuss, and I'll be glad to let you know which one I would select.
Okay.
Darryl, you had your hand up.
Yeah, Terry had some questions about Black American demographics. And in 2023, 48% of Americans identified themselves as being Black. And as far as geographic distribution, 56% of Blacks live in the South, including Maryland, that was south of the original Mason-Dixie line, Virginia, so most of the people on this broadcast are located in the South. 17% are in the Northeast United States, 17% are in the Midwest, 10% are in the West. And so for the Great Migration of 1910 through 1930, only 44% of Black Americans moved north. My message is the ones that moved away from the South, we need to come back home. There's strength in numbers. And, things like our Black churches, our HBCUs, they're outgrowths of the benevolent societies that we set up after slavery. We are odd man out in America right now. We have to take care of our own, and we have to take care of our own through more widespread societies. Churches are good. HBCUs are good as a start. We need a more encompassing umbrella to take care of Black Americans since we're odd man out. we had the right approach with the benevolent societies. You know, the idea is that one alumni contributing $1 can do mighty things. We have an economy with, they say the economy of Black Americans is, if it was a combined economy, it would be the 10th strongest country on earth if we put our money together, if there were strength in numbers. We could do a lot of things that the federal government is no longer willing to do for us, educationally, medically, research. You've got HBCUs with their hands tied behind their backs because they're taking federal funds, and so they no longer can do medical research that focuses on Black people. You take away that condition of federal funds, and if they're funded by the Black community, there's all kind of medical research and treatment that they could do for the Black community. You know, look at the three states that he mentioned: Alabama, Mississippi, and Alabama, Mississippi, and Alaska. And it's not just a 100-mile trip in Alaska to get to a hospital. There's people that live in Greenville, Mississippi, that they only have a clinic. They do not have a functioning hospital in Greenville. They got to make a 90-mile trip by car to get to a city with a hospital. You know, this is our people in our South. This isn't Alaska. We're talking about food deserts. We're in medical deserts in the South. So anyway, that's my story, and I'm sticking to it.
Okay.
You know what?
Okay.
If I just make one statement, I did a graph myself. I did a graph, and I tried to measure out the total population of the United States, and then I started looking at what is the percentage of where the total number of Black Americans. 13%. And when I did the graph, it was so tiny, the where I shaded in where the Black people but then is it true? You know, I couldn't figure out what it is, but
it's 13%. 13%.
Is it 13?
Yeah, 13%.
Yeah.
Yeah.
Okay.
Right.
Okay. Because I know that the information was that the Hispanics for the first time had
well, about 10 years, they're about 17 to 18%.
Right. Okay.
In the United States are Latino Hispanics.
Some of the research,
they're the largest minority population.
Yeah, some of the research is
and
done.
African Americans are second.
Yeah, some of the research is done by people of color. You do people of color, the percentage is high.
I'm sorry, say that again.
Sometimes the research is done using people of color, not African Americans, not Hispanic, but
well, they do look at the different ethnic groups because that's what
they do
talk about, ethnic groups. And so the Latino, Hispanics, and African Americans and the other minority groups are looked at. But I just want you to know that the 13% is African Americans, and 17 to 18% is the Latino Hispanics.
Okay.
Okay. See you all next Thursday, God willing.
Okay.
Outstanding. Right. Thank you, Dr. Callender.
And Dr. Callender, how can I reach you to say, what is your email?
Callender@howard.edu. CCALLENDER@howard.edu.